started here. Good morning or good afternoon, everyone. Welcome to today's webinar, Future-Proofing Urgent Care, Strategies to Outpace Competitors and Drive Growth. My name is Ryan Sadlier. I'm a NERUCA board member and chair of our education committee, and I'm so happy to have all of you with us today. So before I get started, I just want to go through a quick housekeeping items to help make most of today's session. First off, this webinar is being recorded. Following this session, you will be able to access this recording on demand through Zoom and our YouTube channel. We'll have time for a Q&A at the end, so feel free to submit your questions at any point using the Q&A box at the bottom of your screen. For those of you who may be new to us, NERUCA is proud to be in the 12th year of serving the urgent care community across the Northeast. We work to strengthen and support urgent care medicine by providing grassroots representation at the local level, tackling legislative issues at the state level, integrating urgent care into broader public health initiatives, and delivering education and outreach to evaluate the role of urgent care in the region. We bring our mission to life through engaging programming, including today's webinar and our annual conference. This year's conference was our largest one yet. Stay tuned for more details as we plan out 2026. Lastly, I'd like to thank our corporate sponsors for their continuing support. Aptitude, BD, BioReference, Extion, Fresh Paint, HealthTracks RX, Metropolitan Healthcare Billing Services, Midmark Corporation, Pfizer, Solve, Medline, Healthium AI, and of course, a special thank you to today's sponsor, Xperity. With that, it's my distinct pleasure to introduce to you Alan and Saji.
Yeah, thank you, Ryan. So I'm Alan Ayers. I'm president of Urgent Care Consultants, which is a premier partner of Xperity. I would say that our purpose at Urgent Care Consultants is to help people start, improve, and grow urgent care centers. Personally, I've been in urgent care now for about 20 years. I've been a CEO, COO, went to the second meeting ever of UCA, the National Association, assisted their board of directors and was involved with scaling that organization for 8 years. I'm also senior editor of the Journal of Urgent Care Medicine, JUSM, and have written several hundred articles on the subject.
Well, it's kind of hard to follow that. CTO at Xperity. My name is Saji Rajashekharan. Been at Xperity for about 16, 17 months now. Part of that, I was CTO for a patient engagement company, and before that, CTO for a cost management portfolio at a large GPO and health informatics company. So pleasure to be here. My goal here is to kind of give a little bit of an insight to how AI is shaping healthcare, and specifically urgent care, and how that can help hopefully you guys that are attending this webinar. Back to you, Alan.
All right, great. So our agenda today, we're going to discuss building your brand, driving repeat patients, including understanding patient expectations. We'll talk about the evolving healthcare tech stack and decision-making and the transformative role of AI, specifically as it relates to urgent care. So starting out, I always like to level set and remind people of, the basic economics of urgent care. I would describe urgent care really as a volume-driven business. And I have in the following slides to illustrate this. This slide is really just kind of a summary of the economic factors, which you can refer back to, but to really kind of paint the picture here. Comparing to retail, in any business, your revenue is equal to volume times rate. And so in retail, that's very simple. How much do you sell? How much do you sell it for? So Walmart sells a lot for less. Saks sells less for a lot. Well, the challenge is in healthcare, our rates are generally set by third parties. So you have insurance contracts, you have the government that set how we sell. Now we can collect our price question would be for the so that volume times rate, that means that our main driver of revenue in urgent care is going to be volume. How many patients have we seen, and how many feet through the door, which goes directly to provider productivity. And so to further paint a picture here, I would describe urgent care as a fixed cost business, because when you start the day, effectively, you're starting with the same team. Part-time flexible staffing, we have found, just doesn't work well in urgent care. It would be great if you could close, like a restaurant, if you could close after lunch and reopen at 5 o'clock. But generally, the team that you start with in the morning is going to be with you for the next 12 hours, which then makes labor a fixed cost. When you add other fixed costs, your rent, your marketing, your IT expenditures, the vast majority of expense in urgent care is already incurred the moment you open for the day. So another way to explain that would be the incremental cost per visit. What additional costs are associated with each additional patient through the door? Well, there are going to be some billing fees. There's going to be lab tests, copy paper, tongue depressors, swabs, those types of supplies. But generally, I would say about 85% of the cost in urgent care would be considered set or fixed. And so with that, what this slide illustrates is, in effect, when an urgent care center opens in the morning, you kind of start out in a $2,000 hole. And then imagine you're in this $2,000 hole, and there's a ladder, and every rung on that ladder is worth about 150 bucks. And you climb, patient by patient. Every patient you see takes you out of the hole until you hit a break-even point of, which can be, depending on how lean your operation is, how large your reimbursement is, typically around 24 patients a day. Well, then every patient you see after that, if 15% of your costs are variable, by definition, then you would have about an 85% margin on every additional patient. So once a center hits break even, almost every additional patient flows through to the bottom line. And so you could also think of it that you work until maybe 2, 3 o'clock in the afternoon. You work for free, and then every patient that you see after that time until close would be your profit. So just again to illustrate the unit economics as to why volume is so important in urgent care. And then with that, to draw an analogy here, and for some reason this complete slide's not showing for me, but I will describe what this slide shows. The typical urgent care is operating at about 43% excess capacity. And so I would define capacity in an urgent care as how many patients per hour a provider can see. There are other businesses that are based on capacity, like a hotel looks at occupancy. If a hotel has 100 rooms, how many rooms did they, their capacity would be to rent 100 rooms, then they would look at their occupancy, how many rooms did we rent? Well, I would say urgent care is very much like a hotel. You could also use an airline analogy in that we have a fixed capacity, which is the number of patients per hour a provider can see, and we have a perishable product. And so like, let's say an airline analogy, an airliner has so many seats. The moment that plane pulls away from the gate, any unsold seats on that plane, the opportunity to sell those seats is forever lost. So that's why it's a perishable product. Well, the same with a provider in a clinic. If a provider can see 4 patients and they only saw 1.7, that means the ability to see the other 2.3 patients is forever lost. We don't look typically in healthcare at labor in terms of capacity, but it is the core efficiency measure for our business. So with this, we have a capacity issue and we have a volume-driven business. So that means with excess capacity, our solution has got to be to drive volume to fill the excess capacity that we have, or make sure that our providers and staff are fully utilized. Now, a lot of solutions that are being being offered really focus on expanding capacity, which is a little bit of a challenge because, you know, if certainly we want to be more efficient, we want to provide a better patient experience, we want to be faster. The faster you are, the more patients per hour you can see, and that expands your capacity. But if you expand capacity without filling that capacity with volume, by definition, or in essence, you're basically decreasing your efficiency. And so with that, it really needs to be a two-pronged approach. And so this slide shows the levers for driving that flow through revenue, driving incremental patients that are going to flow straight to the bottom line. Well, first thing is we can increase capacity. Now, the other challenge we have with urgent care is the seasonality. So you may have times of the year, 3 months of the year, where you are at capacity, maybe even beyond capacity, and then you have 9 months where you know you have excess capacity to fill. That's a different question. But the first thing we can do is have capacity to see more patients. Then with that, very simply, how do you fill the capacity? You fill the capacity with new patients, you fill the capacity with repeat visits from existing patients, and then the other lever that I had mentioned here is increasing your net revenue per visit. So how much can you get per patient that you bring in? With that, I would say patient acquisition is changing, and I really see a big change in digital coming up because of AI. You've probably noticed in Google that the AI assistant in Google is increasingly responding to your searches. And so in the past, and actually if you go back far enough, and someone reminded me this at a conference I attended recently, the original Yahoo was kind of a step-down directory, almost like the Yellow Pages. So if you were looking for clothing, you would start out in the category clothing, and then maybe there was a subcategory children, and then maybe there was a subcategory outdoor clothing, and you would kind of, you know, go through the directory until maybe you found a website that offered what you were looking for. Well, Google transformed that by having a search engine that, you know, if you're looking for children's winter's coats, you put that in Google, and Google would go out and find, you know, the best websites or the most relevant websites to your query. Well, now, rather than provide a list of websites that you can click through and maybe find your information, Google wants to answer your questions directly. And so what we're going to see, and this is occurring very quickly, is that traditional SEO is going to be replaced with what is called GEO, or generative AI engine optimization. And so search engine optimization was all about having the right keywords on your website. So when Google crawled the website, your website had the right keywords. So when someone was searching for an urgent care in Pontiac, Michigan, that had, you know, served pediatrics, that, you know, a website that had those keywords would pop up on Google. Well, now this generative AI engine optimization is going to entail AI going out and answering the questions. And the questions are going to be very different. It may be very specific, like a patient may say, you know, an urgent care near me that has immediate availability. And Google or the AI engine, and in fact, it's not going to be just Google, you know, it will be the idea that we're going to have whatever your AI assistant is, whether that's ChatGPT or something else, that your AI assistant is going to go out and find the answers on the internet to provide, you know, a more specific response to the user. And so key is having information out on the internet where when AI goes to look, it will find the information for your urgent care. Now, some of that is traditional SEO, you know, and I would say the traditional SEO is kind of jacked to open, but there's a concept of authority and trustworthiness of information. And so AI is also not just going to look on your website. It's going to go out in the crevices and nooks and crannies of the internet to find the dirt, to find whatever tidbits of information that may be credible about your urgent care, and bring that into an answer for the user. So the key is now going forward, it's not going to be just keywords on your website. It's going to be embedding information out where people, out where the generative AI goes to look for it. And so that's going to be things like, press coverage. It's going to be reviews. It's going to be social media. And so if someone mentions you on a Reddit forum, if someone provides feedback on a review site, maybe in social media, the generative AI is going to look at all of those sources which it gives authority to. And rather than paid placement, which is somewhat biased, it will weigh the authority, say, well, this is a trustworthy source. This seems sincere. This seems, authentic, that somebody actually wrote this story or posted this review. And that's where it's going to find information on your center. And so with this, it's going to change how people find urgent cares online. And again, this is coming very quickly. Now, I would say, how do you prepare for this? I would say it would be having the structure in place so that the data is out there where generative AI starts to look, starting with your structured data. So this would be your more conventional, having a full Google business profile. Oftentimes I see Google business profiles that are incomplete. If there are fields to complete in your Google business profile, you should complete those fields, robust information, pictures. Also, what is significant with the Google business profiling or profile is online scheduling and reviews. And those are really facilitated by technology. And so the ability for a patient to schedule online, that's really a significant differentiator we see with the Google business profile. Google wants to be more than the yellow pages. It eventually wants to be this AI assistant that you can't do without, but in the interim, it wants to be transactional. And so I have actually seen in various markets, large players that should be ranked the highest organically, but they are not because their listings are very static. The ability for a patient to not only find your urgent care and then to have a Google integration where they can schedule now, join the queue, book an appointment, whatever that process is specifically for your clinic, is significant because it lifts the listing from just being like the static yellow pages to truly being a transactional experience and interactive for the patient, which goes to the point of how else do we drive patients into urgent care. I do think over the last few years, and really we saw a big shift in marketing spend during the pandemic. So when I first started in urgent care, some of the largest urgent care players in the country today at that time were startups, maybe with, up to 5, 6, 7 locations in a specific market. Urgent care was a very local business. And as a result, we really emphasized grassroots marketing. And so, going back 15, 20 years ago, if you opened, or the same is actually true today, you open a single urgent care in a suburb of Chicago, the Chicagoland media market is well over 10 million people. You're not going to be able to advertise on WGN, but you reach the community, you reach people where they are and build your brand locally where your prospective patients are. And so we are, so then during the pandemic, so really before the pandemic, we emphasized getting involved with schools, community festivals, whatever's important to your community. This time of year in the Midwest, we just had Halloween. It may have been trunk or treats. It may be, pumpkin rides. It may be, in the summer, your community may have a balloon festival, or the town where I'm from is really known for its 4th of July parade. Whatever that is, getting involved with those events. Well, during the pandemic, those events were largely shut down. And then at that time, we really saw an acceleration of search engine marketing, paid SEM. And we also saw people asking one basic question, COVID test near me. And so really the name of the game was shifting to digital and being available where people looked for that one specific question, COVID test near me, which has evolved to flu test near me, urgent care near me. Well, what we found is some of that online marketing, the competition for keywords has increased. The number of searches has decreased. The cost per click has increased. And we're seeing that those that have been most successful in driving volume coming out of the pandemic are those that said, we're not going to put 100% of our budget into digital. We're going to go back to our roots. Where did urgent care start? Now, some things with grassroots have changed. Early in the industry, we talked about local print, your community newspaper. Well, that was supplanted by social media, but there are certain tactics that we are seeing success with. And I would say, as far as conventional advertising in your community, billboards, if the billboard is en route or proximity to the center, very powerful way to extend the signage of your center. The best billboards I have seen are, basically across the street or 1,000 feet away, urgent care ahead on the right, arrow, raises awareness of the urgent care. Billboard 5 miles away is probably not going to do much for you, but the billboards, direct mail, we're seeing success with that, attaching a magnet, sending direct mail out to people's households, and then getting involved with the community specifically. Schools have always been a great resource. Kind of a insight I would like to share here. Essentially, any venue that has moms with kids is going to be great for reaching prospective urgent care patients, but school nurses in particular. School nurses tend to have a great degree of influence with the parents. If they pick up a sick child, as the first and last person they see at the school, and school nurses can be tremendous champions for urgent cares. Now, depending on the school district, I've actually worked with school districts that have a school nurse association. And so you take a district that maybe has 25 campuses between the elementary, middle, and high schools. All those 25 school nurses get together once a month for a lunch. They have a school nurses association for the school district. And I found that was really a great way to get in. You could sponsor that lunch, send some Panera bread, have a provider go talk to them. You could also even have like a listserv or an email thread among these school nurses, say, hey, here's what we're seeing in urgent care. Just a heads up, strep's up, flu's up, what's going around, and to build a community with the school nurses that would then carry over as influencers to the moms and dads in the community. So the point of that, to drive volume, new patients, don't forget grassroots marketing. Then I would say, as far as your repeat business, kind of the digital experience that we just described a minute ago really goes to what people expect. And so a challenge that we have, and I would say urgent care is a tech-enabled service. We are not a 100% digital service. In fact, we're quite opposite. Our service is very tangible. Coming into an urgent care, having a provider lay hands on the patient, procedures. You can't suture a laceration over a cell phone. You can't take an x-ray through a cell phone. You can't do a rapid lab test through a cell phone. So we are a high-touch business, but we are a high-touch business that is enabled by technology. Well, with that technology component, I would say that as far as tech enablement, the bar has actually been lifted very high because patients will compare urgent care to the best experience they have ever had with another service provider. And so to make that a little more real, oftentimes people will use Amazon, how seamless the Amazon experience is, or how seamless the Uber experience is. I noted the other day, and I'll probably write a posting on this thought at some point, but I was in a city in a different part of the country, and I wanted to go somewhere, actually out to see an urgent care, and I took an Uber out to that urgent care. Well, the reason why I felt comfortable doing that, because it was probably, 8 or 10 miles away from the hotel, was I had every confidence that Uber would be available to bring me back. If I didn't think, if I thought I was going out there and didn't know where I was going and was afraid, which was actually a concern before Uber. I mean, it was a concern. You take a taxi, you can get a taxi at the airport, you can get a taxi downtown, but can you get a taxi out, at a suburban location? So the reliability, the ease of use. So I actually asked AI. I said, well, to kind of move away from our overused Amazon Uber examples, what other examples can I use? And it suggested Marriott or Delta. I thought those were good examples. If you prefer Hilton or Southwest, we see these same uses of technology. So for instance, with the hotel, I'm more of a Hilton guy. So using the Hilton app, I can book a room, I can check in, I can select my room, I get my digital key, I can check out, I can receive my bill. I can have an entire interaction with the hotel, or an entire transaction. I can have an entire stay at the hotel where I completely avoid the front desk if I choose. It can be a completely digital experience. Well, what does that do? Does that mean there's no front desk at the hotel? No, it frees the front desk to really focus on serving the needs that require a greater complexity of decision making, that require more hands-on, more touch, more really emphasizing the emotional quotient of customer service versus processing routine tasks. So with that, in a digitized world, it's really changing expectations on how people interact with all services. And healthcare is a service. We are a service for people, delivered by people. And so what do people expect? Well, people expect online experiences that are personalized, and they also expect instant gratification. Well, urgent care, we are part of the on-demand healthcare revolution, right? On-demand implies instant gratification. Well, what's instant gratification? One, that we're available when, where they want or need us. We've already invested in the brick and mortar to have the convenient neighborhood location. Well, being available is when they need us, is the ability to go online, get in quickly, get in and out of the center quickly, which then goes to the other point. People expect experiences that are not only personalized and provide instant gratification. The other part of instant gratification is that a service is useful, and by being useful means that we solve their problems. Well, one, solving the problem is delivering quality clinical outcomes. Now, in healthcare, that's somewhat of a given. There's little tolerance, little patience for poor quality medical outcomes. So that's kind of jacked open, or an assumption that they will receive good quality medical treatment. But what else solves their problem is speed, to get in and out of the clinic quickly. And because if I know that I can go to urgent care, be in and out in 20, 30 minutes, I'm going to be far more likely to go than the uncertainty. Is it going to be an hour? Is it going to be hassle? I don't know. I don't feel good. Maybe I'll just go to bed and skip the urgent care. And so all of these things, the personalized experience that is useful and available when patients need us, is driven by technology. So with that, kind of setting the stage for Saji, we'll now shift the discussion over to how technology is enabling great patient experiences that will drive repeat visits.
Thank you, Alan. So Alan talked about capacity management. He talked about how to address demand generation, patient expectations, and some really good tips on grassroots marketing and digital experience. So urgent care landscape is changing fast, as you guys know, and it's not just because of patient expectations. It's also because AI is, I believe, finally moving from theory to practice. So today, we'll just explore how digital innovation, particularly AI, is reshaping operational efficiency, patient engagement, and clinical experience, all areas Alan's touched upon. And I'll also briefly talk about how Experity is positioned to lead this transformation. One thing I've read recently was about 70% of healthcare executives say that AI will be their top investment area in the next 2 years. You're probably seeing that in your own clinics and organizations. But the one addition I would add is that the winners will be those who integrate it into their real workflows, not as shiny standalone apps. And that's a distinct difference, because we're seeing a situation where you have to anticipate how patients are going to use AI to find care, to compare and understand availability, quality, and speed of care. So real quick, this slide, talks about specifically the topic around standalone applications versus how AI can help. We're used to seeing a scheduling app, a billing app, an EHR, each solving a narrow problem. The next wave of innovation is really what I'm calling AI embedded systems, apps that think with us. Instead of navigating, let's say, 10 screens, AI predicts the next action, and it reduces the data entry and personalizes the workflow for the user, whether that be a clinician or somebody on the front desk. And one of the things that we've seen is that, and I've seen this in articles to AMA, I think had a study that says 85% of providers say that manual data entry remains their top source of burnout. 90% of EMR vendors are saying they'll offer some embedded AI feature. That's according to a class research. So think of an EMR that learns your documentation habits or flags incomplete visit notes before you even hit save. That's where the tech stack is heading, and it's a very interesting space to be. So this shift obviously is not just powered by AI, but it's also powered by modern architecture, which includes cloud-native systems, open APIs, because what you want is data that flows seamlessly across these tools and across AI. So when you think about tech stack specifically, what we're saying is we're moving decisively towards cloud-native microservices space and API-first platforms. And they are what I would call architectures that are essential for interoperability, which is really the backbone of any AI-enabled workflows. Standards like HO7, FHIR, they let us unlock data that was really previously trapped inside these legacy systems and create a lot of siloed behavior, siloed workflows and such. 65% of IT leaders in healthcare say that interoperability is their biggest barrier to adopting AI. They're like, we want to use it, but you know what? This doesn't talk to that. So, interesting, but and again, something that we've talked about, interoperability has been a topic. Alan can probably write a whole speech on it, but it is still a really big barrier. And with FHIR APIs, think of an AI service like image recognition or transcription that can plug directly into the EMR, and you don't need to have a separate login or don't need to switch screens or tab over to something else. And it's not just the EMR vendors, that are doing this. And that's the other topic I wanted to bring up is platform players. Alan talked about Amazon. They're a big player in this space. Microsoft, Google, they're all setting new standards in this space. And what we're seeing is this different way of looking at a vendor versus a platform. And what we're seeing is that these are two complementary forces at play. Like on one side, you have EMR vendors that are embedding AI directly, think Epic's ambient documentation or Experity's own ambient scribe feature. On the other hand, we have platform offerings like Amazon Bedrock, which offer foundational AI models for scalability. In fact, we use that in Experity for stability and enhanced scalability and security for specific offerings that we have built. So, we're seeing more and more folks leveraging both a vendor level integration for core workflows and platform AI for advanced analytics or ambient listening or patient engagement. An interesting data point on that is that about 78% of healthcare systems use multiple AI vendors, right? So it's not one, So they're blending a vertical. So for example, an EMR integrated solution and a horizontal platform tool, whether that be Amazon or Microsoft or something else. Let's maybe use this, maybe transition to tech foundation, which is the concept of this, to where AI is already making measurable impact, which is the front office. Alan talked about, this being an area that has a lot of attrition, and he used the example of Hilton, where you could have an experience with a hotels chain without having any direct interaction with the front desk. The same could be applicable in urgent care as well. If you really pay attention, there are customers that are going to a no front desk model. And really, AI is transforming the patient access and front office operation, whether that be call handling to insurance verification. If you think about it, every minute that you save upfront reduces the patient wait time. And Alan talked about patient experience. Reduced wait time just means that they feel better, they feel like they're cared for. Also reduces staff burnout. So when you think about loyalty and patient experience, AI agents, what can they do? They can respond instantly. They can personalize communication. They can handle scheduling in seconds. We have a product called Care Agent that uses agentic AI architecture. It can do nudging, really smart nudges is what we're calling it, both patients and staff intelligently through various steps. In fact, we've already served over 300,000 patients and engaged customers over 1 million times since our launch. And that was just a few weeks ago. So we really see this adoption of AI across platforms, vendors, and patients. And if you think about it, for instance, a patient texting about a fever, gets a response 24/7, can get an appointment link and care advice, all automated but conversational. Think of that paradigm, and that's where things are shifting to. If you think about the front desk staff, we have examples where we've seen AI automating 50% of routine calls. That's rescheduling, that's FAQs, that's directions to the clinics, that's insurance checks. What does that do? It allows the staff to focus on the patient in front of them, right? And clinics using conversational AI report anywhere from 40 to 60% reduction in call wait times. And that's a big deal. If you think about using vendors like Flip, which we have a partnership with, we've seen customers gaining tremendous automation and optimization with partnerships like that. If you look at billing and insurance, AI tools can automatically match patient notes to billing codes, and it can reduce error rates, maybe up to 70%. They can accelerate reimbursements. We have a solution called automated insurance matching that reduces manual review and training while cutting rejections by up to 70%. And there are so many offerings that folks are building that you can leverage. So while AI improves access and patient experience, which are important, like Alan talked about front, it can also help in reducing administrative burden, optimizing administrative operations. To us, what the other thing we're seeing is that one of the biggest impacts might actually be inside the exam room. And this also speaks to patient experience, but also provider burnout. The most visible transformation is happening in documentation, and AI scribes are changing how clinicians interact, right? Freeing them from the screen to the patient. AI listens to patient-provider dialogue, it summarizes it, populates the EMR automatically. Our own touchless EMR journey brings right into the urgent care workflow for both MAs and providers. So this is not just about the providers, it can also be about your MAs. Physicians spend up to, I think about 35% of their day on documentation, according to an AMA study. And if you think about that, AI scribes can cut note completion time 60, 70% and restore, if you do the math, 2 hours per day to providers. And that's a big deal. And if you're in a place where you're dealing with capacity challenges, where you're not able to handle volume, especially in flu season, that makes a big difference. If you play this out, clinician can finish a visit, and before the next patient walks in, AI has already summarized the encounter and coded it, ready for sign up. Right? Wouldn't that be beautiful? And it is there already. The other place we're seeing is AI-assisted diagnostics in education. So, we have a PACS solution, and we have partners like Gleamer and ADOC that allow our radiologists to improve their accuracy and speed. And we're seeing such tools being used across the board. They can identify subtle fractures that not really legible to the human eye. AI is able to find that, can find pneumonia faster, reduce error rate. So these are all areas where we're seeing significant adoption of AI that really helps providers reach their full potential, but also really improve patient experience. Now, one thing I did want to add is that all these tools, they really only reach their full potential when the ecosystem they live in is open, is predictive, and is human-centered. So that's kind of what I want to talk about next. The future is really a convergence of interoperability, predictive analytics, and human AI collaboration. Urgent care's competitiveness really will hinge on, I think, its ability to adopt AI without using its human core. Alan talked about, grassroots marketing in one of the slides, and how you're available to the community you're in, so that human core attachment is really going to be key regardless of how you adopt AI. The 4 topics I have here are pretty self-explanatory. We talked about interoperability really needing to be a foundation. And whether we use a FHIR-enabled data flow or something else, really what we want is EMRs, billing systems, scribes, all speaking the same language. When we talk about predictive analytics, we're thinking about things like AI forecasting visit volumes and making sure that you have the right staffing needs. And it's really crucial for high traffic centers during, flu or COVID surges. There's other ways predictive analytics can work too. In fact, we've seen Midwest Urgent Care using AI-based scheduling improve patient throughput by 20% during peak flu season, right? Continuous innovation, obviously, this is one thing you've seen. Tech landscape is evolving so fast. Models are coming up so quickly. Every week, every month, every quarter, there's something new. And success really depends on an agile adoption and training. It's not shiny new tools. It's not a vendor that says, I can do X, Y, or Z. It's how all of that is part of an ecosystem in one platform that can help you make your work seamless and more optimized. And the last piece is really that human AI collaboration. And AI isn't replacing empathy. It's creating space for it. So whether you think about solutions like Care Agent or AIM or Scribe that we're offering, the real innovation isn't just the digital part, it's deeply human. And that's really what I wanted to close today with, is that the urgent care centers that thrive won't be the ones that have the most technology or the most single point solutions. It's those that connect that technology and people seamlessly to deliver smart and faster and more compassionate care. And I think with that, we're going to wrap up the content for today, but I think we may have a quick poll before we go to Q&A. So folks, if you don't mind, please participate in the poll, and then we'll jump into Q&A.
Sajid, can you just verify you can see the poll?
I can.
Wonderful.
Thank you, Ryan.
All right, everyone, that concludes the presentation. Thank you so much, Alan and Saji, for sharing your expertise. I'd like to jump over to a Q&A. So as a reminder, feel free to submit your questions using the Q&A box at the bottom of your screen. Where is this here? So we'll jump right in here. Alan, first question's for you. You mentioned with urgent cares, about 85% of the urgent cares are seeing 50 visits or less a day. What specific operational strategies can increase capacity and flow through revenue for these clinics?
Yeah, so I would actually say the focus is really more on driving volume, which would be that flow through revenue. As we kind of discussed the basic economics of urgent care, once you break even for the day, where every incremental visit is essentially 85% margin or more. And so with that, it's how do we drive feet through the door? Well, end of the day, a lot of it just comes down to executing well on the core urgent care business. We talked about marketing approaches, but also opportunity that for patients who have a good experience at the harvesting review. So at the end of their visit, receive a text message. Will you provide us feedback? Following up on that feedback, if there's a service recovery issue, get that resolved right away before you create a detractor who's going to go out and tell others not to use your urgent care. In effect, to counter your marketing. The positive reviews is really a numbers game. So the more reviews you get, the better Google actually looks at the quantity and quality of reviews. So encouraging patients to do that, providing a link, a mechanism for patients to drive reviews. And then as far as, we talked about marketing tactics for new and visits. I would say for repeat visits, again, it's a matter of providing a good experience, meeting their needs, reducing friction. What we talked about, what consumers now expect in a digitized world, that you're going to solve their problem and you're going to solve their problem quickly with as little hassle as possible. We do have, and every week, I speak with folks. They're kind of looking for silver bullets. Well, if we have excess capacity to fill, why don't we look at doing other things? So frequent ideas that come up would be, well, we could be a med spa. We could do weight loss. We could do vanity IV, kind of wellness IVs or hormones. I would say the challenges with those types of businesses is often we find that the juice isn't worth the squeeze, meaning that some of those types of businesses are consumer discretionary. And so when the interest rates are high and the rent's going up and the groceries are going up, is somebody really going to take money to get something, like a inner beauty or brain boost IV treatment. And so, and then also I would say that the competition for some of these other types of businesses can be greater than even for urgent care. So if you look on Google for a med spa or look at these services, may actually be more competition. And so what I'll find is some of these things, where we say that is the juice really worth the squeeze, that they can be a distraction for management. They can actually be more difficult. They can split your marketing efforts. They can split your attention or take your focus off the core urgent care. So I would say, really the key is to executing well on the core urgent care business to drive word of mouth, drive repeat visits, versus trying to look for, silver bullets, magic, some magic potion to fill the excess capacity. One other point I would make, we talked about the revenue equation, so volume times rate. Well, filling excess capacity is a volume question, but in terms of rate, although our rates are set by payers, are we fully optimizing rates? And so there are a number of things that go into net revenue per visit. Some of it is the charges that you're billing out. So assuming you have fee-for-service contracts, are you doing the full scope of lab testing? We see that with some payers in some states that PCR reimburses very well. Are you offering the full scope of lab tests that's really clinically necessary to provide a good clinical outcomes for that patient, and that reimburse well? So I would say looking at your labs. Another component of rate is not only what you bill in terms of the CPT codes, or those CPT codes reimbursable, but consistency among patients. I think there's a big missed opportunity around standing orders. Standing orders can really accomplish a couple things here. They open capacity. So, from a throughput issue, how do we speed throughput? How do we open capacity? Well, if you think of a conventional urgent care visit without standing orders, there's a lot of wait, and the Toyota management system says wait is equal to waste. And so wait, the patient comes in, they fill out an intake form, the MA comes in, goes over that. And then, what are you here for? Then they go to the provider, and the provider orders the lab test. And then that takes time while the patient waits. And then the MA comes back and collects the sample, and then runs the lab test. And then the provider comes back. And so you see these steps where standing orders really simplify the process. The patient comes in. If they meet the criteria for the standing orders, so if strep is going around, they may have a sore throat with no fever. The MA goes ahead, executes or performs the rapid strep test. So when the provider comes in, they would say, "I have your test results. Let me check you out. I've already sent the script," and those can be very short visits. Some of the statistics around standing orders, when we look at the percent of patients with symptoms who receive a test, we see a big gap. And so what I'm referring to is a patient comes in with flu symptoms or maybe COVID symptoms. What percentage of patients who have a chief complaint that would indicate COVID or flu actually receive a COVID or flu test, or it can be any test, strep. And during peak season, 68% of patients who have symptoms associated with the test receive the test when a diagnosis is made. Off season, it's only 30%. And so that would indicate standing orders are not being consistently used off season. So I was a little long-winded about that, but I would say, one thing that one solution that would solve both your throughput capacity, open capacity, speed throughput, reduce visit times, improve the patient experience. All these things are interconnected, while also potentially increasing your net revenue per visit would be to consistently use standing orders.
That's great. Thank you, Alan. There are a couple of questions in the chat if we'd like to address those. First, how do you recommend approaching workflow redesign so that the technology fits the way providers already work, rather than forcing providers to change to fit the system? Also, does this mean telemedicine is archaic?
Yeah, I can have a crack at it. And Alan, maybe you can answer the telehealth question. So the short answer for that first part of the question is the key is really to start with how providers actually deliver care today, right? Not how the technology vendor assumes they should. And ideally, these are designed in a way that the workflow with your clinicians using real observations and rapid prototyping. So I'll give you maybe a couple of data points. One is, start with observation, not configuration, right? Before turning on any really new system, we got to understand how the providers or MAs are behaving, or what their workflow is in the exam room, at triage and during discharge, and mapping that actual workflow sequence in terms of where is time lost, where is information duplicated, what's done verbally, what's done on paper, and understanding or identifying what providers consider like this is non-negotiable, right? I really want to have eye contact with patients, or I want to have specific shorthand in documentation, and really having that day in the life baseline is what we need. So like, for example, when we were deploying AI Scribe, we spent a lot of time recording actual encounters, even before we wrote a line of code, to identify moments where providers would pause or dictate or multitask. And those kinds of insights help shape how AI should listen versus when it should remain silent, right? Another data point is to design workflow around the clinical roles and not the features. So we have to consider within the urgent care, each role, MA, provider, front desk, how they interact with the system. And they all interact with the system differently. So making sure that those workflows that you're using or your vendors are proposing are persona-based workflows, so that each group sees what they need to see and what's relevant to them. And this whole one-size-fits-all approach, whether that's screens or templates, honestly, they slow everybody down. And really the best adoption comes when the system mirrors how the care team collaborates during that 10 to 15-minute encounter. The AI Scribe example, again, for us was that we know that there is an MA to provider handoff. And so we designed ours so that the vitals, reason for visit, notes collected by the MA automatically fed into the AI Scribe's context. That saves time without changing anyone's natural handoff rhythm in that clinical setting. And the last thing I would say is that, whenever you have thinking about a new product that you co-design and pilot with your real providers, and ideally you're looking at integrating, not overlaying. Like providers resist tools that feel like an extra layer between them and the EMR. So when we were looking at AI Scribe and Care Agent, we built it basically to directly interact with the EMR and that workflow. So that's my quick answer on that first part. Alan, you want to take the telehealth question?
Yeah, so a number of things. I actually wrote a blog entry this morning. It will be on the Urgent Care Consultants LinkedIn page, I believe, posting on Thursday. We're hearing quite a bit about the parity cliff, and I wanted to address that in the context of telemedicine. And so effective September 30th, the pandemic Medicare parity, which would basically say parity can mean two things, that telemedicine would provide the same types of services as an in-person visit, and then also they would be reimbursed the same as an in-person visit. That is ending, but only really affects Medicare. And I pulled a statistic that it looks like only about 4.5% of urgent care visits are billing Medicare. It does not include managed care, so like Medicare Advantage plans. So if you look at the percent of urgent care visits that would not be affected by the parity cliff, it's probably like 95% of urgent care visits are either commercial, managed care, workers' comp, in some other category. There are 15 states that do have telehealth parity laws in effect at a state level, and then there are a total of 32 states that expand parity to Medicaid. But again, those rules don't necessarily apply to privatized Medicaid. So states like Ohio, there are 5 managed care players that every Medicaid beneficiary participant has to pick a managed care company, and those managed care companies are kind of outside of these rules. So I would say some of the hype that we're seeing really around the parity cliff just doesn't apply to urgent care. So wanted to address that. In regards to telemedicine, I would say that one of the concepts in healthcare is the right care, the right location at the right price. Our advantage and what we bring is the brick and mortar location. Can telemedicine be used to augment your brick and mortar location? I would say for follow-ups, establish patients, repeat visits, there is some small opportunity there. Do we really want to cannibalize our in-person visits with telemedicine visits? Because even with parity, there are services that we offer, and I would say that our strength and our differentiator, our advantage is the brick and mortar location. As I mentioned before, can't take an x-ray over a cell phone, can't collect a lab sample over the cell phone. And so I would make sure that, and the competition in telemedicine, if you are offering telemedicine as a consumer, am I going to look to my local urgent care for telemedicine, or am I going to hear all the health systems, primary care, the insurance companies themselves? Your Blue Cross Blue Shield card probably has telemedicine through like an American Well. Telemedicine providers advertise on TV. Amazon offers telemedicine. Do you really want to compete with those folks for a somewhat commodity service? Or are you set up to do the things that really make the brick and mortar location bring value in that kind of healthcare delivery ecosystem, such as, is your X-ray staffed? Are your nurse practitioners competent in providing routine procedures like sutures, INDs? Making sure that are there instances where you could be administering IV fluids, perhaps for gastro issues where you previously haven't? You have time, you have capacity to do those things, and those can all drive reimbursement. So really, I would say, rather than focus on telemedicine, I would say focus on executing well and the things that really differentiate urgent care and that go to urgent care's value proposition, which is the neighborhood location.
Thank you, Alan. I appreciate it. Thank you also as well, Saji. So we're just about at time for questions today. If we didn't get to your questions, or if something comes up to mind later, please don't hesitate to reach out to admin@neruca.org. We're happy to continue this conversation. So with that, I'm happy to close out. Alan, Saji, during today's presentation, I want to thank you for partnering with us on such an important topic, urgent care medicine, and it's been a pleasure learning from you today. Thank you very much.
Yes, thank you.
Appreciate it. Take care.
Have a great day, everyone.